Really awesome to have you on the program, Sharon, and good to connect with you again. It's a real pleasure to have you with us to share your insights with the audience. But for those that don't know you in the audience, I'm sure they'd love to know who you are, what you do, and where you're calling from.
Sure, Jerry, Stan, thanks for having me. Really great to see everyone here, and really great to see invigorated New York digital health ecosystem that you guys have brought on. Just a quick background on Tau. We are an AI first fund, meaning we invest in really early stage AI and healthcare and enterprise companies. We come in primarily in around a 500K check, just really wanting to be partners around people building significant and AI levered tools within these ecosystems in healthcare and broadly enterprise in general. And then a little bit about myself, came from a computer science background, also in medicine, and worked as a software engineer before moving over to the investing side. So really excited about this space, honestly.
Yeah, no, wonderful to have you on, Sharon. And because you've had that experience of working with and looking at different technologies that are looking for that kind of funding and that investment, we'd love to hear some real world examples of successful applications of AI in healthcare settings that you've seen recently.
Sure. I mean, I think with the boom of ChatGPT and generative AI, there's just been kind of a really big increase in a lot of people building AI tools in healthcare specifically, but just in general as well. We started the firm in 2019 and kind of just seen like a really big movement towards investing in kind of AI tools. So to give you a couple of examples, I'll bucket it in 3 different categories. The first being applications in clinical practice and clinical workflow. So we see companies like Abridge being part of the clinician workflow when they talk to patients. And also companies like Iterative Health, where they're leveraging AI for computer vision to detect polyps and cancer early. So in that space, a lot of AI is used. You hear about AI in radiology and pathology, as well as AI kind of integrated within the interactions between patients and clinicians. And then I think on the second bucket, you'll see a little more, we're beginning to see a lot of companies kind of really in the back end of healthcare. So looking at things that patients don't usually see, like billing or insurance payouts, claims, reimbursements. To be honest, a lot of these kind of workflows in what we call the back end of healthcare is really exciting to us. And I think ChatGPT and large language models in general has unlocked a lot of these kind of paperwork workflows to be automated. And so that's somewhere that we've made investments in. Companies such as Alafia Health, Glydian, and the like have all fall within the coding billing space. And then the third space in general is kind of tech-enabled care. So we see a lot of AI in mental health, AI in chronic care management. Those are really broad spaces that large language models can come in to a second and third order kind of application manner, can be really, really, really impactful. So I'll give an example. This is not a company I've seen, but I've seen a lot of young founders trying to build in this space. So as kind of companionship, algorithms come out and get pushed out. Of course, there's a lot of ethical concerns that come along with it, but we're beginning to see that that's not, the first application that people think of when they see Gen AI in healthcare, but that's definitely something up there that, is a really big application and might be in the future.
Yeah, no, absolutely. Yeah, thanks for breaking it down like that. Really good. It's really good to be able to sort of get those, get that insight in those sort of 3 sort of categories to sort of be able to get a good idea of sort of where these applications are at the minute. We have a couple of startups and investors as well in the audience, and I'm sure they would love to hear from your point of view what are the current sort of key trends and the emerging technologies in the field of AI at the moment, and data analytics, of course, with this being a Bridging the Information Data Gap symposium. Give us some thoughts around that, and where these emerging techs and data analytic pieces are going in healthcare in a minute.
Yeah, we're starting to see a lot of less of point solutions and a lot of more integrated both vertically and horizontally integrated solutions within healthcare. I think when you think back into, the early 2010s or even like 2015 and a little bit onwards, see a lot of point of care solutions where there's an app, for example, and you take a picture by the bedside and it tells you what skin disease it is. But nowadays, you see a lot more companies willing to be are able to work with health systems or payers, large payers, or even large pharma to be more integrated within their workflow. I think this is partly an attitude change from these large systems. I mean, we just heard from one, and also just started being able to have the technology and lever it to take more risks and to take on more within the healthcare ecosystem. And so I think in broad strokes, that's kind of what we're seeing. And, I'll give kind of a couple of examples of spaces that we're seeing this. One space that we see is just in cardiology. Within the tech-enabled care model, you see a lot of companies building not only upstream when the patients see the providers, but also downstream once they leave the hospital and maybe have to do at-home care, therapeutic movements and things like that. They're also being taken care of through technology and by technology as well. So that's just one example, but there's plenty of spaces within things like chronic diseases that are big killers in the US, like cardiology, like cancer, that we're beginning to see kind of tech really being able to be levered to help patients.
No, absolutely, and thanks for giving us those examples. If if you folks in the audience want to hear a little bit more around key trends in emerging tech that Sharon's come across, please do connect with her via her LinkedIn in the chat. And just to wrap up, Sharon, I know we only have 1 minute left, but we heard earlier around how healthcare professionals are sort of coping with some of the strains that they're going through on a daily basis. Just to sort of close us off here, we'd love to know how can healthcare professionals be trained and prepared to work effectively with AI systems, in their daily work that they're doing right now?
Yeah, I think that I see my colleagues around me, and I think it's just a matter of being familiar. Professionals and providers are trained in a certain way, and everyone goes through so much training that I think on the other end it's hard to you hear the saying of like, doctors don't want extra clicks, no matter how efficient or beautiful the UI UX is. If you make an EHR system, for example, that includes one extra click, they're much less likely to use it. So I think on the provider side, it's just kind of getting used to it, used to tech, and being open to it. I think in general, it's more of a culture and attitude change, but also being practical and knowing when to use it and when not to rely on it. I think that's one of those conversations that are going to be continuous out there in the near future as kind of AI is being pushed into the hospital in the future. Yeah.